Hi, my name is Dr. Carrie Gans, and I want to talk to you today about sleep apnea. Now, it has been suggested that there are in excess of 18 million undiagnosed cases of sleep apnea in the US alone. Now, there are several reasons for this. First of all, many people just don't know the condition exists. They don't know what sleep apnea is. They just think their nighttime sleeping is normal. Secondly, if you live alone, nobody knows whether you snore, nobody knows whether you're getting up in the middle of the night, and you may be unaware of it. Finally, people who believe they may have sleep apnea just aren't willing to go through some of the testing that's necessary to diagnose it. You see, in the past, you had to go to a sleep center. That meant leaving your home, going to some facility, getting plugged in with all kinds of wires, staying overnight trying to get some sleep, and then getting a result the following day. Well, that no longer is the case. Today, we have take-home sleep tests that can be done in the comfort of your home. They're shipped to you. You do the test, you ship it back. A licensed pulmonologist reads the test, and they can diagnose what your condition is, whether you have no sleep apnea, mild, moderate, or severe. Once a diagnosis is made, then an appropriate treatment can be planned. Now, you may ask yourself, why would a dentist get involved with this? Well, there are several treatments for sleep apnea. One is something called the CPAP, which is a device that you wear at night to provide oxygen to your lungs. The second treatment, which is very effective, is an oral appliance. Well, that's something only a dentist can do. Now, the other reason is that we tend to see patients more often than the physician. We see patients 2, 3, 4 times a year, sometimes more often than not, and we can interact a little bit better. We have a little better understanding of who and what people are because we see them more often. That's why we at the Dental Spa at Garden City have decided to participate in the treatment of sleep apnea. One, because we see people and care about them, and two, because we are trained to make the kinds of appliances that are necessary to help people breathe better while they sleep. You see, some people actually stop breathing hundreds of times an hour while they sleep. Their bodies just don't get enough oxygen. So if you feel tired during the day, you wake up tired, you're driving and you tend to nod off at the wheel. Now, there are thousands of deaths every single year due to what we call drowsy driving. This can be avoided. If you find you're at work and can't concentrate, if your spouse or significant other tells you snore loudly. Now, there are several conditions that predominate when and contribute to sleep apnea. So the moral of the story is what you need to do is become diagnosed. So you give us a call, you come in for a free assessment. We'll then submit all the forms that are necessary to have the testing sent to your home. Most, if not all, of the costs can be paid for by your medical insurance. So there's no reason not to do this financially. There's also no reason not to do this mechanically. It's done in your home. And you may not only save your own life, but you may save others. You see, sleep apnea contributes to heart disease. It contributes to strokes. It contributes to diabetes. And as I said, thousands of deaths every year due to drowsy driving. So please give us a call today. We're here to help. My name is Dr. Carrie Gans. You can reach me at 516-741-1230. We're located here in Garden City, right across from Roosevelt Field Mall. Feel free to give us a call. Tell Laura, who answers the phone, that you'd like a free sleep apnea assessment. You'll come in, you'll fill out a simple form, we'll chat a little bit, and then you'll decide whether you want to proceed. There's no cost to you for the consultation, and truthfully, you'll know beforehand if there's any cost whatsoever for the diagnosis and or the treatment. So give us a call. Once again, Dr. Carrie Gans, 516-741-1230. Call us today.